Welcome back and welcome to Focus on Health Law. This is proudly presented here by attorney Kenneth Haber. Attorney Haber has a rather busy practice in Boyd's, Maryland. However, he deals with clients on an international level. Therefore, he's an internationally renowned attorney. Today, our moderator on standby is attorney Ramesh Khurana. He has plenty of questions for attorney Haber on Medicare Advantage organizations. Attorney Khurana is the chief attorney and counselor at law at the Khurana Law Firm, located in Gaithersburg, Maryland. Let's hear these two attorneys in their exchange of legal words.
My name is Ramesh Khurana, attorney at law. Today I am very pleased that Mr. Kenneth Haber, who is a very experienced and knowledgeable attorney in the field of Medicare issues and medical field, he has been helping physicians, doctors and other medical service providers throughout the United States. So today he is going to answer our questions in regard to Medicare Advantage organizations. Let us see how important this concept is, and I think everybody should try to know the answers to the questions which I am going to ask from Ken. Ken, welcome to our studio.
Thank you.
And by way of introduction, Ken is the former assistant U.S. attorney and a senior attorney in the Office of Inspector General. And he has been in the field of Medicare fraud issues for the last 36 years. So Ken, my first question to you is, of course, I'm going to ask many questions.
Yes.
Yeah?
You always
are
do.
ready?
Piercing,
you are ready?
yes.
Wonderful. Piercing questions.
Piercing.
Okay. Piercing and penetrating.
Penetrating, yes.
Yeah. Okay. Good.
Insightful.
Insightful. Well, new word. Okay. Now, what is a Medicare Advantage organization and how critical it is to know about this organization, especially a person is in the Medicare field? Can you please explain this term?
Certainly. The federal government, through CMS, Center for Medicare and Medicaid Services, which is basically Medicare and Medicaid, Medicaid being with the states, has sought various ways to provide services to people in an alternative to the fee-for-service, that's the traditional Medicare methodology of payment and rendering services. And Medicare Advantage organization is a style of providing services, a method of providing services that has recently come out in the last 10, 20 years. It first came out as what's called HMO. And HMOs were initially in the private field, and Medicare felt that they'd like to try to enter them into the Medicare area, and they started with HMOs, and as time went on, they started calling them Medicare Advantage organizations. And Medicare Advantage organizations have the same general formula of methodology of rendering services, that they will get a patient in, a client in, and they'll take their payment and they will provide a package of services to them, and that would be all encompassed within a particular Medicare Advantage plan. And Medicare Advantage organizations are basically insurance companies that are individually in these Medicare programs, and they will develop different plans. Different insurance companies, and a particular insurance company might have a half a dozen different Medicare Advantage plans that people can subscribe to, and the different plans will provide different levels of services in different areas, and people can try to identify which would be the best plan for them. They'll give them the appropriate services that they need. My wife, we still use the traditional fee-for-service under Medicare. I feel that that's the best for us. Some plans will have optometry and others will not have optometry. Some will have audiology, others will not. You can have different plans that may be appropriate for your particular needs. But as anything, you got to stay on top of it to make sure that you're getting the type of services that you need.
Okay. Now, please explain the related subject, which is the Medicare Advantage plan. Can you please explain this point in detail?
The plan?
Yeah.
Well, the plans differ. Any particular Medicare Advantage organization, which is basically an insurance company, will have a number of different plans, and they will have groups of doctors that are associated with them, such as medical management services, independent practice associations, physician hospital associations, that are what would be considered downstream to the Advantage plan. And they're not dealing with the individual doctor, the Medicare Advantage organization. They're dealing with these different entities that have downstreams to them, where the physicians. So the physicians, there may be 1,000 physicians, 2,000 physicians in a independent practice association or a managed service organization. And they have contracts, ditto the contracts that the management service organization or independent practice association has with the Medicare Advantage organization itself. And they're known as downstreams, and they get their payment up and down the network that's established, this network of physician services, hospital services, et cetera, So it tends to get to be complex, but at the same time it's simple if you just think of, the plan as the insurance company, or the Medicare Advantage organization is the insurance company, and they're providing the services through these downstreams. And if you just look at one downstream, say like a management service organization, and then just think of them having a couple of doctors underneath them, but instead of a couple, it's really thousands. And instead of just a single management service organization, there could be a dozen, 2 dozen organizations that are providing these physician services to the insurance company. And you as the patient, you're signing up with the insurance company, and you can select from any of these physicians that are included in the Medicare Advantage organization's plans.
Okay. Now, we have talked about the Medicare Advantage organizations. Now, can you please explain the process which is involved as to how these Medicare Advantage organizations get paid?
Sure. The patients, the clients themselves, the Medicare insureds, pay money to them as a premium. The government pays money to them as well. They'll get a fixed amount of money from the government for a fixed number of patients. And the patients will pay premiums to them as well. And this is how they get paid, except for the extra sick patients. The government knows that and you're dealing with elderly people. The government knows that no one's going to want to take these extra sick patients unless there's extra money involved. So the government pays extra money for the extra sick patients. And there's a whole process in determining this risk assessment of these patients, and that the government is going to pay extra money to these insurance organizations. So actually these patients that are extra sick can actually be, extra pots of money that these insurance organizations want in order to be able to make a profit, make more money. And it depends upon the coding of these patients' conditions to determine how much money the government's going to pay extra to these Medicare Advantage organizations.
Wonderful, wonderful. Now, can you please explain what are management service organizations, independent practice associations, physician hospital associations, and how do they relate to Medicare Advantage organization?
Sure.
Because we have been talking about Medical Advantage organization, I want to see that kind of relation.
Yeah. A management service organization can be just a group of individuals getting together and forming a corporation to provide management services to to different physicians, physician organizations, and they can negotiate on their behalf with insurance companies, with Medicare Advantage organizations, and they can negotiate for whatever they need in order to operate. And the same thing with the other organizations. Some are organized around a hospital, some are around a management company, and the physicians came together, Independent Physician Association, and developed this type of organization, and then they add to it as more physicians come into their geographic area. And those entities will negotiate with insurance carriers, be they private or be they Medicare, in order to get money for, the physicians that are operating under them.
Okay. Now, sometimes there are extra sick patients, right?
Yes.
Now, can you please explain the procedure as to how these extra sick patients get paid for?
Well, the doctors are responsible to code their patients' conditions. And it's this coding.
So, condition-wise, there is a coding system.
There's a coding system which will define how sick the patient is. And these codes have to be sent off to upstream to the Medicare Advantage organization and also then to CMS, Medicare. And based upon the coding will determine how much extra money will be paid for these patients. The sicker they are, the more money will be paid for them. Presumably, if they're very, very sick, they're not going to be lasting that long, but they still have to be paid for while they're here. Some of them are going to be chronic and can last a long, long time in a sick situation where they require extra attention and more payment to take care of their sickness.
Okay. So, Ken, today we have really discussed some of the important concepts of Medicare Advantage organizations and how extra sick patients are paid for. Now, can you please summarize what we have discussed today so that you can talk about some of the important issues relating to this subject? We are just left with about 3 minutes.
Yes. Well, the Medicare Advantage organization is basically the government's attempt to create a system of HMOs, and probably one of the most renowned HMOs, the Kaiser model. But to create these type of HMOs to provide services to people for flat payments for the patient, with structured payment from the government, to provide these services regardless of what the condition the patient is in, depending upon the plan. The plan that the patient subscribes to defines greatly what services that they're entitled to. So they have to be very careful to determine which plan they're signing up with, or else they can be stuck with not getting services that they need until the next year, and assuming that they're able to figure out a better plan, then they can possibly get better services to match their needs. But the government, is wanting to make sure this information is put out in advance so that people can decide in advance, and to the extent that they know what condition they're in or they're going to be in, that they can match their condition with the plan services available to them in an HMO context. The HMO, being a health maintenance organization, standing for Health Maintenance Organization, is theoretically there in order to provide the individual with the services that individual needs in a package, so that not only do you have your primary care physician, but you have your labs, you have your hospitals, you have your nursing homes, all within the context of this HMO structure called a Medicare Advantage organization. This provides the patient with substantial services to meet their needs, so as long as the plan that they subscribe to is the one that matches their needs. To the degree that they subscribe to the wrong plan could make it so that they don't get the services quite that they need.
Okay.
So that there is, you got to have a real connect there, you know, in order to get the proper care. And like I said earlier, my wife and I, we do the fee for service, and we have a supplement, Medicare supplement, and you know, that has taken care of us, and we feel comfortable for that. And you know, but people have to make their own minds up of how they want to do it.
That's very true, very true. No, thank you very much for simplifying this concept, and I appreciate your coming to our studio.
Well, I thank you.
And look forward to seeing you again.
My pleasure.
Thank you.
Thank you.